I want to tell you about three people. The first is a man in his late 60s. He came in looking tired, genuinely tired, the kind of tired that doesn't go away after a night's sleep. He'd also lost about 12 pounds over 4 months without trying to. He chalked it up to stress, to eating less, to getting older. He didn't connect it to anything specific because there was nothing specific to point to. He just felt less than himself. The second is a woman, 64. She'd been having what she described as digestive trouble for the better part of a year. Loose stools, sometimes oily, a faint smell she couldn't quite explain. She was embarrassed about it, to be honest. She hadn't even told her daughter. She thought it was something she'd eaten, or maybe irritable bowel, or just her gut slowing down with age. She bought probiotics. She changed her fiber intake. Nothing really shifted. The third is a man, 71. His main complaint was pain, a dull, persistent ache just below his rib cage on the left side, sometimes wrapping around to his back. It was worse after meals, especially after anything fatty. He'd been taking antacids for months. He thought it was reflux. Three people, three completely different complaints, no obvious connection between them except there was one. And when I tell you what it was, I think some of what you've been feeling, or what someone you love has been feeling, may suddenly make a different kind of sense. My name is Dr. Nora Khalil. I've been practicing medicine for 12 years, and for most of that time I've worked primarily with adults over 60, not because I was assigned to, because I chose to, because I find that this is the stage of life where the body begins to speak in a language that most people haven't been taught to read. That's what this channel is for. We slow down. We look carefully. We try to understand what the body is actually saying rather than just quieting down the noise. If that's the kind of medicine that feels useful to you, I'd be glad to have you here. Hit subscribe, and if this video matters to you or to someone in your family, the like button does help more people find this conversation. Now, let's go back to those three people because they each had something to teach me, and I think they have something to teach you too. The organ connecting all three of them was the pancreas. I know that's not the first thing most people think of when they hear fatigue or digestive trouble or back pain after meals. The pancreas doesn't get nearly the attention it deserves, especially in conversations about health after 60. We talk about the heart, the brain, the kidneys. We talk about the liver when alcohol comes up, the stomach when someone has reflux. But the pancreas, this quiet, fist-sized organ tucked just behind your stomach, is doing two jobs simultaneously every single day that most people don't fully appreciate. The first job is digestive. Your pancreas produces enzymes, powerful ones, that are released into your small intestine every time you eat. These enzymes are what actually break down the fat, protein, and carbohydrates in your food. Without them, food moves through your gut without being properly absorbed. Your body receives the raw materials but can't process them, and that creates a very specific set of consequences. The second job is hormonal. The pancreas produces insulin and glucagon, the hormones that regulate your blood sugar. When the system starts to falter, even subtly, blood glucose becomes unstable, and that instability ripples outward in ways that most people never connect back to the pancreas. Here's what I want you to hold in mind as we go through this. The pancreas rarely fails all at once. It whispers first, and those whispers can look like 7 different things that most people write off as something else entirely. I'm going to go through each one, and along the way, I'm going to show you how they're connected. Because that connection is the part most people never hear about. Let's start with what nobody wants to talk about at the dinner table. Changes in your stool are one of the earliest and most reliable signals that something has shifted in your digestive system. And I don't mean occasional irregularity. Everyone has that. I mean a pattern. Something that started happening several weeks or months ago and hasn't fully resolved. The specific changes to watch for in this context are these: stools that are pale or clay-colored, stools that float and are difficult to flush, stools that look greasy or oily, or stools that have an unusually strong foul smell. Sometimes all of these together, sometimes just one or two. I want you to understand what's behind this. When your pancreas isn't releasing enough digestive enzymes, the ones I mentioned a moment ago, fat doesn't get absorbed properly. It passes through your intestine largely undigested, and it ends up in your stool. Doctors call this steatorrhea. It's not a pleasant word, and it's not a pleasant symptom, but it is a meaningful one. Think of it this way. Imagine you have a kitchen where the cooking equipment isn't working well. Food goes in, but it doesn't get properly prepared, and whatever comes out the other side is incomplete. That's what's happening inside biochemically. Your food is arriving, but the tools needed to process it aren't showing up at full capacity. The reason this matters so much after 60 is that fat is not just calories. Fat carries fat-soluble vitamins A, D, E, and K. If fat isn't being absorbed, these vitamins aren't being absorbed either. And their deficiency doesn't announce itself with a dramatic symptom. It shows up slowly: dry skin, weakened immunity, softer bones, impaired vision in low light, problems with clotting, things people attribute to aging, things that in some cases trace back to something the stool was already quietly trying to say. The woman I mentioned at the start, the one who'd been dealing with digestive trouble for almost a year, who was embarrassed about it, who bought probiotics, this was her first sign. She'd noticed the change, but had convinced herself it was something mild. By the time she came in, she had a measurable vitamin D deficiency and had been absorbing protein poorly for months. Not because she wasn't eating enough protein, because her body couldn't extract it properly. I'm not telling you this to frighten you. I'm telling you this because if this sounds familiar, it deserves attention. Not embarrassment, not dismissal. It deserves a conversation with your doctor. The second warning sign is one that gets misread constantly. Pain or discomfort in the upper abdomen, often just below the ribs, sometimes on the left, sometimes radiating toward the back, that appears after eating, especially after a heavy meal or a fatty one. It can be dull and persistent. Sometimes it's more of a pressure, sometimes it's sharper. It tends to come on 20 to 40 minutes after a meal and can last for hours. Most people who have this reach for antacids, they assume it's acid reflux or indigestion or something they ate. And sometimes it is, but here's the distinction I want you to notice. If this pattern keeps returning, if it specifically gets worse after fatty or rich foods, if it doesn't fully respond to antacid medication, and if it's been happening consistently for weeks, that combination changes the picture. The pancreas sits directly in the path of your digestive processing. When it's inflamed or struggling, eating, the act of eating, which triggers digestive activity, can provoke a response. The organ is being called upon to do work it's having difficulty doing, and it reacts. The man I mentioned, the one taking antacids for months, this was his pattern. Worse after barbecue, worse after cheese, better when he ate very lightly. He thought he was developing a sensitivity to rich food, the way some people do as they get older, and that's not an unreasonable thought. But the location of his pain, the timing, the character of it, these things told a different story. I want to be careful here because upper abdominal pain after eating is also associated with gallbladder problems, and the two can be genuinely difficult to tell apart without imaging. That's not a reason to panic. That's a reason to go and find out. Gallbladder and pancreas issues are actually closely related. The ducts that drain them share a common opening into the small intestine, and problems in one area can affect the other. Gallstones, for example, are one of the most common causes of pancreatitis. This is the part most people miss. Abdominal discomfort after eating is not automatically digestive aging. It is worth being specific about where exactly, when exactly, after what kinds of food. The body is giving you information. Let it. Now, here's where the connection becomes less obvious, and this is the warning sign I find most commonly dismissed, both by patients and, I'll be honest with you, sometimes by physicians who aren't looking for it. Fatigue, not the ordinary kind of tired that comes from a poor night's sleep, from stress, from being busier than usual. I mean a persistent, unexplained exhaustion that sits differently, a heaviness that doesn't respond well to rest, an energy level that used to be one thing and is now something noticeably less. After 60, fatigue tends to get written off quickly. It's your age. You need more sleep. Maybe try B12. And sometimes those things are true. But fatigue that accompanies any of the other signs I've mentioned, or that arrived without any obvious cause, may be telling you something about how your blood sugar is being managed. Here's the connection. The pancreas, through its hormone-producing cells, the ones we call the islets of Langerhans, regulates glucose in your bloodstream by releasing insulin. Insulin is what allows your cells to absorb glucose and use it for energy. When the pancreatic cells responsible for this are compromised, insulin output becomes inconsistent. Blood sugar swings. It goes up after meals, then drops. And when it drops, your brain, which runs almost entirely on glucose, starts to struggle. That's when you get the fatigue, the difficulty concentrating, the sense of fogginess that many people call brain fog. There's also a simpler mechanism. If your body isn't absorbing nutrients properly from food because the enzymes aren't working as they should, your cells are literally receiving less fuel. Even if you're eating regularly, even if your diet looks reasonable, you're eating, but the extraction is impaired. That's an underappreciated cause of fatigue in older adults, and it's one that blood work alone, unless very specifically directed, often fails to catch. My father was a quiet man. He observed before he spoke always. He used to say that when something takes your energy without giving it back, you have to ask why, not just accept it.
He was talking about people, I think.
But I found that the same logic applies to symptoms. If your energy has changed and it hasn't changed back, that's not a question you owe to aging. It's a question you owe to yourself. So, what could possibly connect these three things? Stool that floats and smells different than it used to, pain that surfaces after a meal, especially a fatty one, a fatigue that doesn't really lift no matter how much you sleep. These are not random. They share a root. The pancreas has two layers of function that I described briefly at the start, and I want to come back to them now with more precision because understanding both layers is what allows you to understand why this organ can produce such different-seeming symptoms. The outer layer, the exocrine layer, produces enzymes. These enzymes travel through the pancreatic duct into the small intestine and do the actual work of digestion, breaking down fat with lipase, breaking down protein with protease, breaking down carbohydrates with amylase. When this system isn't producing at full capacity, or when the duct carrying these enzymes is partially obstructed, fat absorption drops, protein absorption drops, and the stool begins to carry evidence of what wasn't processed. That's the first set of symptoms. The inner layer, the endocrine layer, produces hormones. Insulin to lower blood sugar when it rises after a meal, glucagon to raise it when it falls too low. When these cells are damaged or under chronic stress, glucose regulation becomes erratic. That instability feeds into the fatigue, the mood changes, the difficulty concentrating. Over time, it can also show up as new-onset diabetes or as a glucose tolerance problem that wasn't there before. This is why the pancreas is such a silent organ it's doing two jobs at once, and the symptoms of those two jobs failing can look from the outside like they have nothing to do with each other. One person thinks they have a gut problem, another thinks they're just exhausted, a third thinks it's reflux, and all three may be circling the same organ from different directions. The man who came in tired, who'd lost 12 pounds, he had both layers affected. The woman with the stool changes, she had primarily the exocrine layer. The man with pain after meals, his was related to chronic inflammation that was beginning to compromise enzyme output. Very different presentations, same root. I want you to notice something. None of them came to me saying, I think my pancreas is the problem. They came in with fragments, and it was only when we put the fragments together that the picture emerged. That's what I'm trying to help you do right now, not to alarm you. To give you the framework to recognize the pattern before it advances. The fourth warning sign is one that people often initially welcome, and that's what makes it dangerous. Losing weight without trying, without dieting, without exercising more, without any obvious explanation. When weight drops on its own in someone over 60, there's a tendency to rationalize it. My appetite has been off, or I've been less sedentary, or simply, maybe my body is finally adjusting. And occasionally this is true, but unexplained weight loss, I mean consistently dropping weight over weeks or months without intentionally changing your diet or activity, is one of the signs that medicine takes most seriously. Not just for the pancreas, for a range of conditions. But it's a particularly consistent feature of pancreatic problems, and here's why. When the exocrine system is failing, you stop absorbing nutrients properly. You can eat full meals and still run at a deficit. Your body not receiving what it needs from food begins drawing on its own stores. Muscle mass goes first, often, and after 60, muscle is already harder to maintain than it was before. Then fat. The scale drops, but the mechanism is not the one you'd want. There's also a secondary effect. When digestion is painful or uncomfortable, people begin to eat less without fully realizing it. They avoid fatty foods because those are the ones that cause discomfort. They eat lighter meals. They skip things they used to enjoy. The appetite changes are partly physiological. The gut is in distress and partly behavioral. The body learns to associate eating with discomfort, and it quietly starts to resist. The combination, malabsorption plus reduced intake, can produce a significant drop in weight over a period of months. And because it happens gradually, the person experiencing it often doesn't register how much has changed until someone else points it out. Until a photograph. Until they go to buckle a belt and realize they've moved 3 notches. If you or someone you know has lost more than 5 or 6 pounds over 2 to 3 months without explanation, that is not a footnote. That is a data point. It belongs in front of a physician. The fifth, sixth, and seventh warning signs cluster together in a way that makes sense once you understand what's happening physiologically. Let me take them one at a time, but you'll see why they belong in the same block. Nausea that appears without a clear cause, especially after eating or sometimes without eating at all, is a symptom that gets dramatically underestimated in older adults. It's written off as motion sensitivity or medication side effects or a passing stomach bug that never fully resolved. And all of those are possible, but persistent nausea, particularly when it runs alongside other signs on this list, is worth examining more carefully. When the pancreas is inflamed, the entire upper abdominal region becomes sensitized. Eating triggers digestive activity, which triggers pancreatic stimulation, which, when the organ is struggling, can produce a wave of nausea as the body's response. This is a protective reflex in a sense. The gut is saying, slow down. Don't overload the system. The problem is that most people don't know what the signal means, so they just push through it, or they stop eating certain foods, or they take anti-nausea medication without asking why it keeps happening. Changes in appetite follow directly from this. Some people describe a general disinterest in food that wasn't there before. Food starts to feel like a burden rather than a pleasure. Meals that used to be enjoyable become neutral, or even something to get through. In medicine, we call this anorexia, not in the colloquial sense, but in the clinical sense. A loss of the desire to eat, and it can be subtle enough that the person doesn't identify it as a symptom. They just think they're eating less lately. The seventh sign connects to the endocrine side of the pancreas, and it's one that often gets its own separate investigation without anyone connecting it back to the organ producing it. I'm talking about new changes in blood sugar, increased thirst, more frequent urination, blurry vision, shakiness after skipping a meal, signs that glucose regulation has shifted. When the endocrine cells of the pancreas are damaged, whether by chronic inflammation, by accumulated stress on the organ, or by more significant pathology, insulin production becomes unreliable, and the body starts to show it. New onset diabetes in someone over 60 who had perfectly normal sugar levels before is not automatically just diabetes. It can be the endocrine signal of a pancreas under strain. This is sometimes called pancreatogenic diabetes or type 3C diabetes. It's real, it's underdiagnosed, and it requires different management than type 2. The connection across all three of these, nausea, appetite loss, blood sugar changes, is the same. The pancreas is no longer quietly doing its two jobs. The quiet is breaking down, and the body is speaking in the only language it has. I want to be clear about something before I give you the final layer of this. None of the 7 signs I've described today, on its own, necessarily means something is wrong with your pancreas specifically. Fatigue has many causes. Stool changes have many causes. Nausea has many causes. Upper abdominal pain has many causes. What shifts the picture is the pattern. If you have one of these signs in isolation and nothing else is unusual, the likelihood that it points directly to the pancreas is lower. But if you have 2 or 3 of them together, particularly if they've developed over the same period of time or if they've been gradually worsening, that clustering is the thing to take seriously. Let me give you a practical way to think about this. If stool changes and unexplained fatigue have both been present for more than 4 to 6 weeks, that combination warrants investigation. If upper abdominal discomfort after eating and nausea have both been recurring, that combination warrants investigation. If unexplained weight loss of any amount accompanies any of the other signs I've described, that combination warrants investigation. In terms of what that investigation actually looks like, your doctor will likely start with blood work. A complete metabolic panel, a lipase level, which is an enzyme the pancreas releases into the bloodstream and which rises when the pancreas is inflamed, and a fasting glucose or HbA1c to assess blood sugar regulation. They may also order imaging. A CT scan or an MRI of the abdomen can show changes in the pancreatic tissue, size, or ducts that blood work alone cannot reveal. I want to be thoughtful here about the range of what these signs can indicate. In many cases, and I want you to hear this, the underlying cause is something like chronic pancreatitis, which is inflammation over time, often related to factors that can be modified. Diet, alcohol, medications, or sometimes gallstones. In other cases, it may be pancreatic exocrine insufficiency, the enzyme production problem, which can be directly addressed with enzyme replacement therapy and dietary adjustments. The outcomes in these scenarios, when caught and managed well, can be genuinely good. In some cases, these signs can indicate something more serious, and I'm not going to pretend they can't. The pancreas is an organ where early detection makes a meaningful difference. I've seen both. I know what early looks like and I know what late looks like. And one thing I can tell you with certainty is that the gap between them is not imaginary. The patients who do best, the ones I've watched maintain their independence and their quality of life through and beyond a pancreatic diagnosis, are not the ones with the lightest history. They're the ones who came in early, who didn't spend 8 months telling themselves it was just their gut getting old, who brought the pattern to a physician and said, "Here's what I've been noticing. I'd like to understand it." That's all this is asking of you, not to catastrophize, not to assume the worst, but to notice the pattern, take it seriously, and let someone with the right tools look at it with you. The pancreas is not an organ that broadcasts. It doesn't cause the obvious dramatic pain that makes someone call an ambulance. It doesn't show up early in the standard panels that most people get at their annual physical. It sits behind your stomach doing its two quiet jobs, making enzymes, managing blood sugar, and when it starts to struggle, it speaks in the language of other things. Fatigue that seems like age, digestive changes that seem like diet, discomfort that seems like reflux, weight loss that seems like coincidence. What I hope you're leaving this conversation with is not fear. Fear is not useful. What I hope you're taking with you is a framework, a way of seeing a cluster of symptoms as a pattern that deserves a question rather than 7 separate inconveniences that deserve 7 separate dismissals. Your body is not your enemy in this process. It's doing exactly what it's supposed to do, sending signals. The question is whether anyone is paying attention. If what I've described today sounds familiar for yourself or for someone in your family, write it down. Specifically, when did it start? How often does it happen? What makes it better or worse? What other things appeared around the same time? That kind of careful observation is worth more in a doctor's office than you might think. It changes the conversation. And if you haven't yet, I'd like you to watch the video we put out before this one. After 60, your gut needs this to work properly, but no doctor tells you. A lot of what happens in the gut and what happens in the pancreas are connected. The absorption issues I described today don't live in isolation. They're part of a larger picture of how the digestive system ages, and that video gives important context for understanding why this becomes more relevant after 60, not less. Thank you for spending this time here. I mean that simply and directly. Take care of yourself and pay attention.